people suffer other things, like, I know people that have like chronic headaches, right? And things like that. That can be debilitating and it can take you out of your game. It's the same though, like in terms of your process of understanding what's doing that, what's aggravating that. Sometimes exercise can make that stuff feel better. Sometimes it can make it worse. You need to accept this, right? And figure out that workaround. There's other things that come up, that aren't necessarily related to that. Maybe you're having gut issues, right? And that's impacting, the energy that you have or the comfort or discomfort that you're feeling, during, before, or after a workout. Examine this stuff. Don't fucking ignore it. If the body's sending you a signal, it's telling you need to listen to that stuff. And what is it? And don't look to a supplement or some diarrhea tea or, again, like an elbow sleeve to fix a legitimate problem, right? And problems are normal. That's the other thing to bring up here. Like if you're feeling that, you're not weird. Like this isn't unnormal. We deal with that stuff personally. We've already talked about that, right? And all the time. It's a product of the lifestyle we've chosen and the things that we've chosen to do. And it doesn't mean we're doing things wrong. It means we're doing things. And could we be doing them better? Right. So on the other side of that, with regard to like when you're starting to feel that discomfort and you're starting to move through and you're starting to discover this stuff for the first time, not being afraid of it, but checking in, like you said, and then being willing to push yourself, a little bit to the next level to understand what that is. And then at some point also be willing to go like, this is bigger than me right now. I don't know what this is. And where do you go? So what are the steps that you could take to understand, like, is this something I should be training through, training around, or not training at all? And that's where a lot of frustration ends up turning up, because you could go to 5 different people and get 5 different answers, right? Where are you going for your information to understand what it is that you're feeling, why it is that you're feeling it, and how could you feel better? We talked about this on the show. We just did an episode on this, like the world of information. There's never been more of it, and people are never more confused than they've ever been, right? So I would be careful about that, like in where are you going, and what is that person's best interests as compared to yours, and how are you diagnosing those things? And everybody's an expert now. Just look at their Instagram profile; they'll tell you right in there, right? It'll say they'll put all the things in there for you, and you'll know. The point of that being, stop it, like. Be discerning, like look at things with a critical eye and know where to go. So there are different places you can go or different people you can go to help you maybe identify what those things are. And just because your knee hurts doesn't necessarily mean you need to go to an orthopedic surgeon that does ACL repairs all day long, right? That guy's got a specific job, right? Right. And I'm not saying he's going to want to repair your ACL if it doesn't need repair. I'm just saying, like, pump the brakes. Like what are the types of practitioners or professionals that you could go to maybe help you get a little bit deeper understanding, and then help you advocate for yourself if you have to go to the next level. And I think that's an important, and it's a roadblock for a lot of people, and it can either drive you deeper into the hole that you're already in, way deeper than, making sure you're making the right decisions. Don't go to the one person for the one answer that you've already pre-diagnosed yourself with because the Google told you. That's very frustrating for me. When I talk to people, I'm like, they tell me they have this thing. I'm like, cool. Where'd you get that information? Right. And that's an interesting one for me. Yeah. So you're laughing about it because you get it. You want to talk about it?
I mean, just Googling and everyone has a rotator. It's my rotator cuff. I mean, that's probably one of the ones I hear the most. My shoulder hurts. I have a rotator cuff problem. What do I need to do to strengthen it? And I mean, just even with the age of social media, like seeing the random, this one exercise will fix your back pain and just things like that. And just knowing that whether it's pain or injury, there's a lot of complexities to this, and that there's no silver bullet to fix things initially just with that. And it is managing. I mean, there is we're going to always go back to, there is mechanisms and load and all these different things, but a lot of it is lifestyle. And are you stressed, and are you not sleeping, and how's your diet, and how's your hydration? Like, those are all factors. And when you're doing these check-ins with yourself over this continuum of like managing or rehabbing, is really just assess, are you we've talked about the same with like fat loss or muscle gain, where it's these waves, but it should be towards the goal. There are going to be waves and good days, good weeks, bad weeks, but it should be heading towards the goal, whether, up or down, right? So the same thing with managing pain or injury is keep checking in. Like, it's not necessarily going to be gone one day, but am I continuing to slowly get better, or am I continuing to slowly get worse, or is it staying the same?
Be honest with yourself.
Be honest with yourself. Yeah. And if those answers aren't the answers you want, then that's where you really need to assess, like, okay, what do I need to change? Do I need to reach out to a practitioner? Do I need to reach out to a better or a different practitioner? Do I need to look at some of my lifestyle and take notes of those things? But having patience in the process, and that's really just an important thing to remember. So.
Yeah, I think it's having patience in the process, but it's also going back to, Scott, you mentioned tracking, and we talk about tracking in a variety of different ways, whether it's with nutrition or whether it's with your strength training. So if you don't know what's causing the issue, and you're not tracking, then how are you going to know? Whereas if you're tracking, you can reflect back.
Just a paper trail, yeah.
Exactly. So this is what I did on this day. Maybe it could be this. And then maybe you institute that during your next workout, but not necessarily at a heavier load, at a lighter load. How does your body, and then assess, how does your body feel while you're doing it? How does your body feel the next day? How does your body feel the day after? What other symptoms may you have or not be experiencing? So I think you also have to, it's having that awareness and having that tracking. But as far as then, so you have that tracking mechanism, but then like you said, so where do you go?
Yep.
Who do you resource? Are you going to go to your general practitioner, your regular family doctor for this? I don't know. In my experience, I think that's probably one of the worst places to go. But that's just me and my experience of the people that I've dealt with over, 30 some years. Do you go to a physical therapist?
What would you know anyways?
I know. What do I know? Would you go to a physical therapist? I don't know. Like it depends. It depends on
the therapist.
Exactly. So, so where do you go? Do you go to Google? Well, we've just had that conversation as far as Google. So maybe you work with a personal trainer.
Yeah.
I
think the answers that people probably be looking for is, okay, you're right. I don't know. Like, where do I go? How do I know? So here's some tips. First off, Ryan just went down a list of things. If you go to somebody because you're having knee pain and they don't ask you about the things that Ryan just mentioned, well, tell me about your exercise program. Tell me about your diet. Tell me about your lifestyle. Tell me about how you're sleeping. Are you taking any supplements? That kind of stuff. Those are questions that I want my practitioner asking me. And the only people I work with are the people that do ask those questions or I can have that conversation with. And I recognize for somebody that's kind of coming into this for the first time, that's very tough to do because how do you know what questions to ask? But those are things that I want my practitioner in whatever realm I'm working in for my personal health and wellness. And I work with very few of them and it took me a long time to find those people, right? And some of them are sitting at this table, right? But those are questions that a true healthcare professional should be asking you in my mind. So going back to like general practitioners, orthopedic surgeons, physical therapists, they're all usually specializing in one or a couple of things. And maybe they don't generally ask those questions. It's not because they like orthopedic surgeons don't ask those questions. Maybe yours isn't, but the ones that I've gone to, right, for the things that I have, we have those discussions. And part of that is advocating for yourself. The other part goes back to the tracking stuff, right? So you're trying to gain awareness and you've got this record of, the things that you've done, whether it's been tracking your workouts, your nutrition, your sleep, all those things. Some people are very, consistent with all that and take a lot of care in doing that for them. Well, what does that do? While you've been trying to gain awareness, you've now just prepared yourself to provide your practitioner with awareness. Right. So that you can you're already preloaded with the answers that that we want them to be asking you, that if you don't have those answers, they're going to have to figure that out. And so are you.